For lower and middle income countries, there's a stark contrast for capabilities required to actually implement the COVID vaccine rollout and all the testing and treatment, et cetera. And the challenge just increases as we get further and further downstream. So what are those challenges in lower middle income countries when it comes to their supply chains? There's a risk of government non-payment for services when the private sector gets involved. There's pricing instability that's exacerbated by local conditions within the local logistics markets. There's oftentimes unavailability of quality logistics assets. So whether that's warehouses, whether that's vehicles, it could be trained staff, et cetera. There's a lack of civil society involvement for accountability and advocacy around the use of private sector logistics. And on the public sector side, the lack of civil society involvement and lack of accountability when the public sector is directly implementing those logistics solutions. Finally, we'll get into vaccination. Unique challenges, I think, are fairly obvious when it comes to supply chain, but the temperature-controlled movement of goods is extremely important, especially when we get into the frozen and ambient vaccinations that are out there. So once you get past just your ability in country to move products with proper temperature in place, you actually have to monitor the temperature to ensure the efficacy, of the vaccines in movement, and then you have to get into accountability. Now, when we're talking about lower middle income countries, accountability is really hard to achieve because all these different systems don't connect and don't interact. And you often have donors and other third parties bringing products in. And so as product moves or vaccinations move and change hands from a warehouse to a transporter, from a transporter, and it starts to just decentralize and move downstream, the accountability oftentimes gets lost. From a procurement standpoint, really, there's a lot of needs assessment and supply planning, right? So it's understanding what the demand is, understanding what the supply requirement is, thinking about the prioritization of how the supply actually needs to be allocated, and starting to get ahead of the process now to plan for a phased implementation of the vaccine rollout. Other things we could be doing is supporting the procurement of the PPE, the syringes, the needles, the gloves, get ahead of the curve. So we're not waiting on that once the vaccines arrive in country. The last thing I'll just mention is bringing advanced technology to bear, right? And we've talked a lot about temperature monitoring, but visibility, the ability to see products as they move throughout your supply chain, hold accountability to all the various people who are involved in the process. That's really a technology solution and something that's been absent in lower middle income countries to date. And we really need to bring that advanced technology to bear.